And thank you all. First webinar about the care coordination team. So basically, we want to give you a brief background and a brief introduction on who the rest of the team is and what our role is in terms of communication and liaising communication rather between you, the providers, and your patients. So it's really good to get to know each other. Dr. Khan, finally, good to meet you. This is my
Yeah.
first time to see you. We've been talking a lot through emails.
Good to see you. Nice meeting you.
Yeah, we've been exchanging a lot of emails. We've been getting like a lot of patients that would like to see you right away. So, but thank you so much for being super, super accommodating. We appreciate it.
You're welcome.
Right. Okay, cool. Um,
Great. Yeah, we'll give it maybe one more minute. I see some more
yeah.
folks coming in, so we'll give it a minute, and then whenever you guys are ready, just go for it.
Is Ryan joining the call, by the way?
I don't believe so. Oh, never mind.
Oh, there he is.
Okay. Great. Well, Janine, I think whenever you're ready, we can get started.
Right, cool. Yes. So yeah, let's not wait any further. But first of all, again, I'm Janine. I'm currently the head of care coordination. I know some of you may have been seeing my name a lot on your emails, Dr. Dat, Dr. Khan, Karen. I know that we've been like getting a lot of email exchanges, Gladys as well. I hope you guys, yeah, first of all, thank you so much for being super communicating with our team. So we greatly appreciate everything that you do for our patients and for working closely with us, with our advocacy of making every patient's lives better. So yeah, is somebody gonna be share? Am I gonna be sharing my screen for like the rest of the presentation, or Angela, can you do it for
Yes,
me?
I got it.
Yes, please. Thank you. All right. So again, welcome to Clinic. The goal of this webinar is basically to introduce the rest of the care team and provide an in-depth understanding of how our team facilitates communication and coordination between you, the providers, and our patients. And we aim to ensure that EU providers are fully informed about who is managing patient care transitions, how these processes support enhanced care and delivery. Now, the care coordination team's mission composts of ensuring timely and efficient care. So, if you would notice, we've been communicating with you a lot. We want to accurately assess patients' needs, and definitely we want to facilitate smooth transitions to appropriate healthcare providers. So, we do a lot of the triage on the back end. We do have automations that does that for us, but a lot of it also has manual involvement from the rest of the care coordination team as well. So I'm here. So these are like the few names that may be coming up a lot on your inboxes. And sometimes I know that we guys, our team members give some of you a call for like immediate issues that we want to get addressed. So yeah, we also have Alexis here on the call, by the way. She's going to be heading our care management. Alexis, if you could give a brief introduction of yourself as well.
Yeah, of course. Hi, everybody. I'm a little bit newer to the team. It's really good meeting all of you. I've been super excited about this. So I'll be kind of the head of care management. So that encloses everything that happens after a patient has their initial appointment. So really working on getting those follow-ups scheduled and things like that is where I'm coming into play a little bit more. If you guys ever need anything, please feel free to reach out.
Okay.
Thank you, Alexis. And we have Shayna. She's not on the call with us today, but I know that some of you may have seen her before. She's been part of the clinic medical office hours that we have twice a week. She's basically our point of contact for provider and patient communication. She's basically one of the main care coordinators who have started clinic medical with us. And then we have Jessa, who is our point of contact for benefits and eligibility verification. A lot of our benefits and eligibility verification we do in depth just to make sure that all the patients that we are sending for you to be seen are all billable and qualified based off of our credentials. We also have Regine, who is our point of contact for training and development. So whenever there are new updates, that the rest of the team needs to know, she is the one responsible for rolling it out and having everything else documented, and as well as if we're going to have a new team member that will join us. So she's going to be in charge of that. And then we have Margaret. I know that some of you may have been seeing her name on the emails a lot. She is our point of contact for all the labs and drug screenings. So those are like the most common names that you would be seeing a lot. But all in all, overall, we have a total of 11 team members in our care coordination team. So we all specialize in triage, intake assistance, and appointment scheduling as well. So the rest of the team members play a crucial role in ensuring that every patient receives timely and efficient care by accurately assessing their needs and facilitating smooth transitions to the appropriate healthcare providers. So yeah. Do we have any questions about our team members? Are we good? All
So,
right.
so if someone needs to contact any of the members of the care coordination team,
Mhm.
they can just write an email, or you also have their contact numbers, phone numbers, if we need to contact or if patient needs to contact.
It's basically just the 206 number, Dr. Khan, the one that we have on the website. That's the only phone number that we have right now. And then it's basically all the calls are sorted throughout our call tree. They do have the options that they will just have to choose, definitely, where they're going to have to listen to the prompts. But I would highly recommend that if any providers would need communication with the rest of the care team, just send an email to the care@clinic.com, the one that we usually use to communicate. We have a dedicated team member that monitors that, so we get to respond faster.
Right. So what 206 number one more time? The number.
Oh, sorry, Dr. Khan, that's 206-495 0724.
Okay. Thank you.
You're welcome. Perfect. All right, and then we're going to talk a little bit about the triage process and the way that we assign providers. Now, we do have our triage criteria here. Our team conducts patients' triage based on their geographic location. That's number one. The specific treatment that they're looking for and their insurance coverage. So those are the three main points that we are looking at when it comes to triaging the patients. Now, we're very meticulous about this process to ensure that all patients assigned to you are both qualified and billable. And we like to optimize the efficiency of your practice and minimize unnecessary delays. Additionally, we address all patients' concerns prior to scheduling to guarantee a smooth and productive initial appointment. Although I know that there are some patients that come in, we're gearing towards MAT or medication assisted treatment, but I know some, when they see you for the appointment, suddenly they're looking for like AUD or alcohol use disorder. I know that there have been a few cases like these where patients, like when they come to join the appointment, they suddenly are looking for a different treatment. But definitely we aim to make sure that the specific treatment that these patients are looking for are definitely ones that we actually cover. Right. So yeah. Any questions about our triage process? No, we're good.
No, I think that there was I had been talking with Jen about it that in the initial paperwork and forms that everyone fill out the that WHO questionnaire, PHQ-9 and GAD-7. I know it had been taken out where it wasn't part of the initial paperwork, but
Mhm.
then I thought we were discussing about that it be put back in
Yeah,
so it can be completed prior to the initial visit.
right. Actually, that's true, Dr. Dad. One of the things that we found that may be causing delays, or what we're trying to see here, or we're trying to gauge, is I think some of the patients may feel like our intake forms are a little bit long, or it takes time for them to fill out. Actually, we have an initiative on our team that we actually stay on the phone along with the patient while they're filling out their intake forms. So it takes about 30 to 45 minutes just to fill that out. Now, definitely, once that they have decided that they are to move forward and push with the appointment, so once that they book the appointment, we send those three forms, the PHQ-9, the GAD-7, and the WHO-QOL. We send that an
Who's
hour
that?
prior to their appointment. That way, we would make sure that hopefully before they join the call, they would already have that filled out. I know some do comply and then some don't. So yeah, but
Okay.
we would be more than happy to, bring that back in along with the appointment, with the initial intake forms that were sent out.
The biggest concern I've heard from patients, they say they just have a hard time understanding what the questions, like how to actually fill the form out. So that's why a
Oh,
lot of times they don't fill it out. So I'll go through the questions with them
mhm.
because they just weren't sure how to actually fill it out. They said they felt confused while filling it
Oh,
out. For those who have never filled one out before.
oh, okay. What are those going to be for those like survey forms or just all the intake forms in general?
No, just I don't fill out most of them with them, but the GAD-7,
Oh,
PHQ-9, and that's included in the initial assessment.
right.
So they were like, "Oh, I just didn't understand the questions. I had a hard time understanding." So then I'll just walk through it with them, and
Mm-hmm.
we'll do this. I'll just do it with the patient.
Hmm.
But a lot of times when I ask, like, "Hey, I see you guys didn't complete those forms," they're like, "Yeah, it just seemed confusing. I wasn't sure how to answer those types of questions."
Oh, I
I said,
see.
"Okay, that's fine." I said, "No problem. We can do it together."
Right.
And we go through it together on the initial visit. So
Okay.
this patient
Um,
feedback from those who I've noticed who haven't filled it out.
I
I can
see.
actually address that. I don't think I've met any of you here today, but my name's Ryan. I actually was recently brought on in January. I work in operations. And Dr. Dat, actually, that's something that just came up a couple of days ago that I just started looking into, which is our intake process, how the forms are sent, notifications, what's not being sent. And so that's really good feedback, actually, for me to take a look at those forms and see what that process is, yeah, something similar just came up a few days ago. So I thought I'd put that on your radar.
So I have a question too. This is Gladys. I was told that the GAD-7 PHQ-9 we don't need, it's not mandatory for them to fill out before they sign up to see us. Somebody told me like something like that some few days ago because I asked that the patient fills the form out before I see the patient, but I was told it's not necessary anymore. Is that correct?
Actually, it's still required for them to fill out prior to the appointment. But I believe I think Shayna was the one who called you I think was it last week, Gladys?
Yeah,
But
somewhere, yeah.
yeah, so basically it's still a required form. It's just it was taken out on the initial set of intake forms that we have that we send them. And this is something that is definitely sent to them 1 hour prior to their appointment. But it's definitely not a factor, or it's not of these three forms not being filled out is not a qualifier for their appointment not to push through. Because I believe that there would be, some scenarios where they would, prefer to have it fill out with you alongside with them. And I think a lot of these patients, since we've gotten like a few feedback that it's been hard for them to understand how to fill that out completely. I hope that makes sense.
Yeah, that makes sense. But then it's very it's a lengthy especially appendix 8 there. That's a lot of questions, and it takes much of your time explaining and everything. It takes a whole bunch of your time.
So Gladys, in my experience, I will just go through the GAD-7 and PHQ-9, and I'll ask the patient to complete the HU questionnaire later. If
Okay.
the patient is pressed for time on the initial, I'll just put in the chart. We'll have patient complete before next visit. And if it's
Okay.
not completed before that visit, I'll try to address it during the follow-up visit. Of
Okay.
course, within time, right? If the time's available. Yeah, so
Okay.
I'll just make little notes in that section. But I personally have never filled out the WHO questionnaire with the patient. It's just too long. So at
Yes.
least I'll get GAD-7 and PHQ-9 out of the way. That gives us diagnosis, right?
Right.
So that's something we can address in the future. But
Okay.
I'll at least, if it's not done in the beginning, I'll try to get it done within the first couple follow-up visits.
Awesome.
Yeah.
Thanks for
That's what
the.
I do too. Aren't they supposed to fill those out monthly?
I'll send, if I feel that I need the score updated, I'll either do it myself or I'll request the patient to fill that out, and I'll email care coordination and say, hey, can you make sure you resend that form prior to the next visit? But to my
Okay.
understanding, it didn't have to be monthly. It was to our discretion as the
Okay.
provider if we felt like we needed an updated score or not.
Gotcha. We did them monthly where I worked before, and it was very time consuming.
Mm-hmm.
So that's good news.
Yeah, and just to clarify, definitely these three intake forms or these three survey forms are being sent to the patients monthly. It's a recurring form that they are to fill out. So it's it's being sent out to them every 5th of the month. So just to make sure that they get that updated as well. All right, cool. Any other
So
questions?
it is due monthly then. It is, they're told it's due monthly.
Yes, it is. It's being
Okay.
sent to them every 5th of the month.
Okay, thank you.
You're welcome. All right, and then next for our patient scheduling, definitely our team schedules appointments based directly on the availability that you plot in your clinic EHR. To ensure that there are no conflicts, we highly recommend that you sync your clinic EHR calendar with your personal calendar. And this integration facilitates a seamless scheduling experience. So I know that sometimes there are like scenarios where there are conflicts in scheduling. So we highly recommend that you have your either your Google Calendar or any other calendars that you have synced with your clinic EHR calendar. Now, when patients request immediate or earlier appointments, I know that you guys get this a lot, we prioritize communicating with you to obtain your approval before making any adjustments. And this process allows us to accommodate urgent patient needs only when you have the capacity, though, and ensuring we respect both your schedule and the patient's immediate health requirements. And also, one of the things that we have observed very recently, like if the appointment is booked too far out, it is a cost of it. It's highly likely that the patient would no show. That's why we would, be very aware that it's either we do well, not definitely same day. I know that's quite not so ideal, but at least the day before, or at least just 1 to 2 days maximum far out, if that makes sense.
I have a question.
Yes,
So,
Karen.
so recently, this is my job now. And for the last couple weeks, like I have a lot of open availability, and you can schedule my patients the same day, which that's been done, and I'm fine with that. But I've noticed the last couple weeks that a lot of my scheduling hasn't been filled, and then on the other hand, I've had a lot of no-shows. So consequently, I haven't, had as much as money as I thought I would. So, is there anything I can do? I mean, I have availability 6 days a week, most days, 8 to 10 hours. So, is there anything else I can do or I need to do or?
What,
Ryan, oh, sorry, Angela.
I was just gonna ask, what state are you in, Karen?
I'm in Pennsylvania, Angelo.
Okay, gotcha.
Yeah.
Yeah, I will, I'm more on the go-to-market side and patient acquisition side.
Okay.
I will,
Yes.
we'll definitely look into that. That's also great feedback.
Okay.
So on that side, that's something that we'll look into and we are trying to do scheduling a little bit differently right now and kind of play around
Okay.
how we are doing scheduling because as Janine said, when people are booking kind of further out in advance, there's a higher likelihood that they no show. So right now, we're testing this out with Virginia first, but we're actually only letting patients schedule out 72 hours in advance. But we're actually playing around with other things kind of in the background just to optimize for the show rate. So there might be a slight, dip right now, but that's something that we're kind of picking up. So we should see that
Good.
in the next coming weeks.
Yeah, that's good. I'm like, did some patient, was there some feedback a patient gave? Because most of my patients seem to be pretty satisfied. And I thought, is there something that happened? Did I do something wrong or so?
Oh, it's just kind of part of this new process that we're working on. So within the next, these are very recent changes
Harika,
too. So
these are good to go, by the way.
we'll be seeing some changes there in the next couple weeks.
Okay. Thank you.
Yeah, I guess
I too experienced that at the beginning where it was very slow about the first month and then it quickly picked up.
No, but I've been doing this since September. So
Oh, wow. Okay.
yeah. So I mean, I was like one of the first ones, and then it did. You're right. It picked up really, really well, and then all of a sudden, like the last couple weeks, it's really slowed down. So I was just concerned if I need to look somewhere else or what.
Yeah, that was probably due to some of the changes that we made, but
Okay.
yeah.
Thank
And
you.
then
We'll review all that. Yeah.
Thank
And then
you.
regarding the follow-ups, I've been notified by 2 patients since yesterday and one of my first patients this morning that said they're no longer receiving the text message 30 minutes or 5 minutes prior the visit. So I was wondering if maybe that's why, like yesterday, I've had about 6 no-shows, which I normally don't have that many, and
Wow.
they were my regular patients. I just moved to bi-weekly. So I've been seeing them every 7 to 10 days, and I just moved them to bi-weekly, and I had 6 no-shows yesterday. So my patient was actually concerned because she moved her appointment up a few days, saying that I know we moved to 4 weeks, but I received no communication from clinic, especially like the day before. So she's like, I just got nervous and thought either I missed my appointment or she just before was getting more of that texting type contact. And she's, I was just shocked that I didn't receive anything prior to today's visit.
Ryan, do you
Okay.
want to actually just
Yeah,
go off track here and maybe show the new flow?
I have it. It's not like polished or anything, but I guess what I can. I was gonna address no shows, and that's something that I'm also working on as well. With Angela and a few others here. Like we said, we're limiting some booking and availability for newer patients to be like kind of a shorter time frame. What we're seeing is that patients who book an appointment sooner that are new are less likely to no-show because that window of motivation that they have to make changes or get help actually that's catered to that window for them. So it's usually pretty short. I come from a mental health background and it's usually the case there too. When somebody has like major depressive disorder, their window of motivation is very, very small. So we're playing around with that. And then the other thing that I'm working on right now is trying to organize our notifications and reminders that we send to patients about their appointments. So that could actually be something that was caused by kind of what we were playing around with and changing. Right now, let me just pull it up. I'm sorry, I don't have it, but right now we send reminders and notifications to patients about their upcoming appointments at 72 hours prior to their appointments, and then 2 hours prior to their appointment. So people who aren't getting those texts, that is a problem, and I'm not sure why that's happening, but that's really good feedback that I'm going to immediately after this call, just go and test and see what's kind of happening there. So.
Thank you. Yeah, I think maybe some disruption or I don't know, some type of error.
Yeah, it sounds like it.
Yeah, to have 6 no-shows yesterday, and that's a lot for the patients who have all shown up for their other visits. I just thought that was kind of strange. I had success, and we were working on their mental health issues as well. They're stable, and then to have 6 no-shows for people I've consistently been seeing, I thought, wow, maybe they just totally forgot about their visit, and hopefully we'll reschedule them in the next few days.
Yeah, just to let you know, I will be going and looking into that right after this call, and once I do have like next steps or some feedback from what I find, I'll let you know kind of what I'm doing to fix it.
But I guess you could also go ahead and give them a call if there are no shows, if they are not showing up over the Zoom. How about that? Because we have their contact numbers and we can wait for some time. If they don't show, we can just give them a call that, hey, listen, this is your appointment time. Just come over the Zoom.
So I do that after I log into the call, and if someone doesn't log in within the first 3 to 5 minutes, I call their cell phone to remind them, hey, can you please restart your app and log into the visit? And generally, if they answer the phone, it'll be, oh, I forgot. Oh, I didn't receive the text. They'll log in, which is fine. So generally, that's my rule. If somebody doesn't log into the appointment, wait 3 to 5 minutes, call the number that's on file. And if they answer, there's a good chance they're going to log on to the call. So that's me doing my part, but yeah.
I'm also planning this.
I was told we can't call the patient.
Typically, that's not the process that we have in place here. The process, from my understanding right now, is that if a patient is no showing or you need to contact a patient, you typically would reach out to the care coordination team, Janine's team, to call them or to get into contact with them. I don't really see a reason why we can't have a system for providers to get in touch with their patients when they need to. And so it's actually something that you should see an email from clinic, myself, and Jen Smith in the next day, end of week at the latest, where I have actually set up a call through system for all of our providers here to call their patients without having to utilize another system or log in. It's a call through system. I'm not sure if you guys are familiar with how that works, but basically what you would do is you're just going to go ahead and call the clinic main line, and it'll give you an option. It recognizes your phone number to make an outbound call without making any of your phone number wouldn't be visible. The patient would see the clinic phone number as the caller ID. So you should have the ability to do that either today or tomorrow.
Oh, great.
Certainly before end of week. Yeah.
Great.
So you should see an email. The only thing that you need to respond to that email with once I kind of roll it out is just whichever number you're planning to use to reach out to patients, like your cell phone number, if that's the one you're going to use to use the call through feature. I just need to put that into the system so that it lets you do that. But other than that, you should have that ability. I know, Dr. Dat, you might be utilizing a different service or system to make those phone calls. You're going to be able to do that directly through the clinic main phone number.
I'm using Doximity, which was recommended when we first did our onboarding, and it has the 206 number every time I call. It's just, I personally thought it was better to call the patient because in live time, by the time if care coordination is able to contact them within a few minutes of receiving the message, a lot of times what will happen is the 20 minutes will pass and then they'll have to. So I just started making that phone call to at least then I can send a message to care coordination where I normally include contacted the patient, left a voicemail. Now it's your guys' chance to reach out to them.
Yeah, it's another kind of smaller solution to kind of tackle the problem of no-shows. But yeah, once like 5 minutes, 6 minutes passes and the patient hasn't shown up, I mean, there's no way to, especially for a 20-minute follow-up or even a patient, it's a reschedule at best, depending on how long. And we're trying to minimize the time to contact the patient. So.
Okay, Ryan, also the chat features have been disabled in the video.
Mhm.
Sometimes we tell the patient to log out and log back in because of technical issues. You can't chat with them on the chat on the video screen. That is disabled. Can they enable that?
You mean during the visits?
Yes.
Chat or okay. I'm not aware of that one. Like I said, I'm a little bit newer, so
You can turn that on yourself. I've done that. That's what I do. You just hit
okay.
the chat, and it says the chat hasn't under where you call them, and it says it hadn't been set up for that client, and then you ask if you want to modify it, and I say yes, and go to settings and hit let them chat. That way you can turn it off or on whenever you want.
Team,
I
I don't
don't
know.
use my cell phone, so I use the video, the healthy the chat on the video system itself, where it has the speaker, the mute
That's what
sign. There's a chat icon there. Then when you click on it, it says this hasn't been enabled for you.
Then you can
Okay.
change that.
Oh, I didn't know you can change that. I tried. I don't think it allowed me to change it.
Well, I don't, that's how I mean, it let me, I don't know.
Do you do it on your desktop?
Yes, but I don't do it till after I hang up from the call the first time.
Oh
It
no,
won't
this is when I am actively talking to the patient, and sometimes there's a technical issue.
You have to turn it on when you're not on with the patient.
Oh, then that's why. But I wanted it to be
Yeah,
enabled whilst I am.
We'll make a note and just try and get that just enabled as a default for everybody.
Okay.
Yeah. Just so you don't have to go in there by yourself.
Also, with scheduling, are the patients doing their own scheduling?
Yes, the patients are able to do self-scheduling.
Okay.
Wonderful.
Because I see sometimes these patients, they will schedule multiple times, they cancel multiple times, they like to go everywhere to schedule on your availability. So I was wondering if the clinic was doing that or they were doing that themselves.
Oh, definitely the patients have the ability to choose their own schedule. Or to choose their own appointment based off of your availability. I know that there are some that would decide that, hey, I want to do it tomorrow, and then suddenly change their mind and then choose another date. So, yeah, but definitely, yes, all of our patients have the capacity to do self-scheduling.
Okay.
All right,
And even for the initial?
For the initial, yes, they do too.
Okay.
Any other questions? No? All right, cool. And for our last bullet regarding scheduling, if you would prefer a different approach to managing scheduling requests, please let us know. If you would just if you're okay with us reaching out for any like availability outside of the hours that you've already plotted, please do let us know. We aim to balance timely patient care, of course, based off of your availability. So.
Okay.
All right. Thank you so much. And for our last slide, basically communication with the care team. The most efficient method to reach our team is simply by emailing us at care@clinic.com. We have designated team members specifically assigned to manage and monitor these communications. I know in the past that we had some delays in getting back to your requests and with your concerns, but that's something that we're striving to make sure that we are to respond with every message timely, and our commitment is to acknowledge and respond to your inquiries as promptly as possible, ensuring that you receive timely assistance and support. So that's it.
We appreciate
so question
you.
on that.
Let me tell here, we really appreciate your prompt response on every question. It's very quick, appreciable.
Thank you, Dr. Khan. That's very nice to hear.
I have a question on the communication. So if I get an email from the team, let's say I get it from Margaret or Shannon, can I reply to that same email? Because to say Margaret at clinic, can I reply to that message, or I should go out and compose a new message with care@clinic.com, or I can just reply to that message?
Yeah, you can definitely just reply to that thread so you don't have to create a new one.
Okay. Okay. Thank you.
You're welcome. And yeah, so we're all open for any questions. We can have our Q&A session. Any
Okay.
that you may have.
Any question? Okay. This is to Angelo. I was told, I think my other Zoom meeting that we had, one of the providers was asking about being multiple licensed in other states. So I know that when we see patients, we have to be in the states that the patient is currently located. So if you have other licenses from other states, how does that work if you are not in that state?
From my understanding, and I could be wrong, but the patient has to be in the same state, not necessarily the provider.
Yeah, we
Does that make sense?
that are
Really?
seeing patients in multiple
Correct.
states right now. Yeah.
So the patient can be in, okay, so if I'm seeing patients in California, the patients have to be residents of California, but I can be in Virginia.
Yes.
Correct. And not only does the patient has to be a resident, the patient has to be located at the time of that appointment in the state that you are seeing them in.
They can't
I thought
take
they
a
had to be
vacation.
residents. Say it again.
They can't like go on vacation and you still see them. So let's say they live in California and they went to Florida during the time of the appointment with you. You can't see that patient because they're not in the state that they reside in, of which you're credentialed in.
So, okay, so let me reframe it. So you're saying that the patients have to be physically in the state that
that you are licensed and seeing them in. So if you're licensed in California, but you live in Texas as a provider, and you're seeing that patient who is in California, the patient must be physically in the state of California during the time of your appointment with them.
Okay.
Yeah.
Okay. Got it. Got it.
Yep.
Got it.
I have a question about that. So with that, there has been problems with you can do that, but sometimes pharmacies will not fill prescriptions if you're not within a certain radius. So like Walgreens and Walmart have been, there was problems with that. So I would look into that just so you know. You might run into
absolutely.
that issue.
Okay, sure.
That is not the first time I've heard that, so I'm going to make a note about that as well.
So with that pharmacy issue, we're having so many issues with the pharmacy, especially in Virginia here. They just won't fill the medication for the patient because they said you are seeing an online online provider. We don't do that. This is really you know, I can every day I have to go back, change stuff on Arcopia, go back. You know, I don't know why the pharmacists are doing that. That they don't want to fill prescriptions for patients who sees online providers. So the only option is the Pursue Care, and the Pursue Care, the only downside is takes couple of days or something for you to reach the patient. And it's a problem when you're doing induction, you know, that they are not able to get the medication.
So I know that here in Arizona, we had a lot of problems with Walmart, Walgreens, and CVS when that whole government issue came down and they started being sued. They had to put into initiative a whole framework of how they're trying, at least on the opioid side, because I'm coming from pain management. They had to put a framework in on decreasing the amount of opioids that they're sending out. So I have seen quite a few patients from my previous job that were unable to fill their prescriptions because we were seeing them over telehealth 5 out of the 6 months. So every 6 months we would see them in person. But when we saw them over telehealth, we started seeing a lot of issues with places like Walgreens and Walmart and Costco even, where they didn't want to fill anything coming from a telehealth provider. And then some of the pharmacies also have blacklisted a lot of providers that were prescribing opioids and things like that because that's in our wheelhouse of what we were doing. So when I came from the pain management clinic that I was at, Walmart had made it so that patients could not fill any opioids that came from certain providers in our office, and Walgreens did the same thing. And then CVS followed suit after I left, and so it's kind of been like a round and round type thing that's been an issue across the board.
That's good feedback. One thing that I'm looking into personally is our different like pharmacy partnerships in certain states. So we'll keep you guys updated on how that goes. But yeah, that's all good to know and good feedback. That we'll look at.
Yeah. So can you, like, I know we have Pursue Care. Can you have other contracts with other pharmacies that are willing to, provide for our patients, not just Pursue Care? Because Pursue Care, they have to make it depending on the location of the patient and the area the patient, sometimes it doesn't even get to them within 2 days.
Mm-hmm. Yeah, no, that's something
so if you guys can look into that, contracting with other pharmacies that can, get the medication in a timely manner to the patient.
100%. Yeah, we're looking into different partnerships with pharmacies. So we'll keep you up to date.
Okay.
Yeah.
I mean, if you want more information on those pharmacies, I have a previous job, pharmacies that have delivered medications to patients, so I can give you ideas of other pharmacies we've used in the past too.
Sure, absolutely. That'd be great.
Okay.
Absolutely.
I have a question for you guys. When a patient goes to their appointment and the appointment is marked as occurred, do you guys go ahead and schedule the follow-up with the patient, or do you guys get feedback from the patient, say, oh, I'll schedule later on, or I'll wait until the text message? Is that happening often?
When I see the patient, I immediately, after I finish documenting and everything and order the medication and everything, I go click on occurred, and then I schedule the patient myself because I want to see the patient in a week. I'll do my own follow-up schedule.
Got it. Okay. I have talked to a couple patients where they have said like they're expecting an appointment on a certain day and time, but there was nothing in their upcoming appointments. So that's one of the reasons I was asking you about that. But I'm just trying to help work on like retention, getting more patients scheduled and things like that. So like literally in the last week, I've been able to schedule 40 patients back onto your guys' schedules from that. So we're seeing some improvements.
Amazing. Well, if there are no other questions, I think we're good to wrap up, but I think this has been a really productive session here. So we are, just to update you, we're trying to do these kind of department specific sessions weekly, so monthly for each department. So you guys have probably seen other emails from me starting earlier this month on different topics. So yeah, we'll keep you up to date on future ones. And as I said, we're doing one for each kind of department monthly. So yeah, mark it in your calendars
Awesome.
if you want to join. future ones. And yeah, thank you all for joining, and we'll send a recording out to you afterwards as well. And we hope to
Good.
see you on some future calls.
Thank you. Thank you all for doing a wonderful job, the administrative team. That's really helpful. Thank you.
You, Gladys. Thank you, everyone. I appreciate meeting all of you. Talk to you soon.
Bye, guys. Thank you.
Bye.